Joining us now for more on Omicron variant and indeed what India's response needs to be at this stage, we have Dr. Vimal Pahuja, general physician who's been treating COVID patients at the Hiranandani Hospital in Mumbai. Also joining us from Pittsburgh in the US, Dr. Ravi Godse, who is Director of Discharge Planning at the UPMC Shady Side. Dr. Godse, let me begin with you. The WHO talking about the new Omicron variant of COVID posing a very high global risk, also warning of severe consequences in case of a surge. In your opinion, what kind of a threat are we looking at right now? We also have the South African doctor who first flagged this concern, saying so far at least symptoms appear to be fairly mild. There have been no severe hospitalizations. The WHO also conceding there have been no deaths linked to the variant yet.
Let's start with a positive note and let's start only talking about India. The new Omicron is mutated, but I don't think it is mutated enough that it will evade your immunity completely. So the basic question in everybody's mind is if they got COVID and or if they got 2 doses of vaccine, they thought everything was over. The pandemic was over for them. Oh God, is it going to start all over again where a totally new strain comes and they have to start from scratch? That is not going to happen. And the reason for that is a simple philosophical question. How are we testing for Omicron? Using the RT-PCR testing, right? RT-PCR testing uses the same genetic material of the virus to test it. If it is that dramatically changed, how are we able to pick it up from the RT-PCR testing? We are not changing the RT-PCR testing. We are not changing the vaccines. We are not changing the monoclonals. We are not changing remdesivir. We are not changing anything except apart from the changes. So why are we talking so much about the changes? I will say one thing for India. There will be no third wave in India because of the second wave. So many people infected Indians during the second wave. There were so many hidden cases. And that natural immunity actually works better than a vaccine immunity, though whoever got the disease should still take the vaccine. So let me start with this confident prediction that there will be no third wave in India and Omicron. India should be cautious and careful, but absolutely no cause to panic. In fact, India is going to do way better than other countries because India is the only country in the world that has so many natural infections, plus it has more than 100 crore vaccinations. So we are like already boosted. We have a very strong case. And I'll make a quick point. This Omicron also has to fight Delta.
Right.
It doesn't have to fight us. Now you just showed that 13 cases in Netherlands were Omicron, right? And we were saying, oh my God, 13 cases Omicron. But 13 out of 61. So other cases were not Omicron.
Right.
If Omicron is 30 times more infectious than Delta, how is it managing to only 13 out of 61? I think it is Delta will still win out and the people who had Delta will be fine. So there's nothing to worry about for India.
All right. Well, you're being very confident indeed. Dr. Pahuja, would you agree with the assessment Dr. Godse is making? Are we sort of rushing into travel restrictions, further screening, like other countries in the world that are also now considering global travel curbs, especially for those flying in from South Africa and other southern African countries? Do you believe these are necessary?
It's very difficult to fortune tell what is going to happen when the virus mutates, actually speaking. But having said so, it is important that we understand what this Omicron is doing. Is it very lethal? Is it producing more deaths or severe disease or more hospitalization? That we still don't know. But we have to be cautious. Hence, we don't have to be panicking about the virus. But our major basic precautions we have to take. We have to screen the people. We have to do the RT-PCRs. We have to have a basic sanitization, masking, vaccination. Those things should be done actually. But there should be no cause for panic.
Right. Dr. Godse, we heard the US president talk about the need for vaccinations, including booster doses for Americans. But here in India, there is no possibility of a rollout even of booster doses just yet. Do you think, that is the right way forward, given that, there are many who still haven't taken their second doses, and the government is clearly prioritizing vaccination for as many people as possible before booster doses are rolled out?
Yes and no. In fact, I was in a debate with Dr. Arora this morning and I was a little rude to him. So I got this chance to apologize to him. I think I took the booster and we took the booster for a different reason. Vaccines protect you in two different ways. One is against mild disease and one is against serious disease. The protection against serious disease lasts for a much longer time than mild disease. So say Covishield and Covaxin were 70% effective against original COVID. They are 50% effective against Delta. So a doubly dosed person getting disease is not a news at all. We expected that. It's a coin toss. It's what's to happen. But they are being protected from the serious disease. Regarding the booster, the serious disease protection will still last. So it was not necessarily needed. We took the booster for a different reason. We took the booster because 30% of American population is not taking the vaccine. They are unvaccinated and they are driving the pandemic. We had to protect them. Previously, before Delta, the vaccine was protecting us and protecting us from spreading. But with Delta, we were protected, but we were able to spread. Right. So literally, we took the boosters to protect the unvaccinated. In India, I would simply say there's so much natural disease that natural disease can be considered as a booster. I think 80% of Indians are already boosted. So I agree with the government. But the messaging is not right. If they start saying that we need the booster, then people who are waiting for the second dose, there are crores of them.
Right.
They
may in fact not take their second dose either.
And then they take the second dose. Right. They think we are going to need the booster.
Yeah. Okay.
Let me quickly say the healthcare workers who took Covishield 4 weeks apart. 4 weeks apart Covishield is the least potent formula. It gives only 55%. So they should be offered a booster with Covaxin. And it needs to be done today and let the doctors decide. Take it out of the government hand. Put it in the private market. Whoever has the money wants to take it.
Dr. Pahuja, a quick last word. There seems to be some indication from the Karnataka health minister that, there has been a case there of someone who recently traveled here from South Africa, which appears to be a strain different from the Delta variant. So, there is a possibility at least that this could be the first Omicron case, known Omicron case on Indian shores. And it has spread to countries all around the world right now. How worried should India be, or do you believe that this is something that will need to be treated at par with Delta and we move forward from here?
As said, we have been doing the same things what we did with Delta.
Yes.
So I don't think there is any cause for panic. Of course, we should be cautious. As I said, we still don't know whether this is Omicron or not. So rather than speculating and creating a fear, let's be positive about things. And we still don't know the Omicron is really lethal. And we still know we have been infected with Delta. Delta is still predominant variant. We still don't know whether this Omicron, if it takes over the Delta, will be a milder variety, which will be propelling all over the world. And, we not get the severe cases as we are getting with Delta. So lot of things in speculation. We still have to wait and we still have to be positive about things.
But in the meantime, keep masking, keep social distancing, and of course, take all precautions needed. Thank you very much, both of you, for joining us this morning on Good Morning India.